West Tex Wednesday, and Dr. Beck is with us in studio. Thanks for being here.
Thank you.
And we're going to discuss the coronavirus and are there really concerns actually here on a local level in Permian Basin?
Not currently. I mean, obviously, you know, the scary thing about the coronavirus is that you see those numbers increasing daily. You know, it's almost crazy how fast the virus can spread. But again, that's in China and other countries in Asia. There's been little or no disease here in the U.S. I mean, there's been isolated cases, but again, all it takes is a few isolated cases and it can spread.
And I think some of the concerns, too, is that some of the Americans that were quarantined were actually brought here in Texas to some of the bases as well. And then now we heard reports that they're now out of the state for those who tested positive. But we're also saying that it's very similar to the flu as well.
Yeah. The way that it spread, the symptoms are almost identical. There's almost no way to differentiate it without very specialized testing. The flu is very contagious. We know that it's spread via respiratory droplets when people cough, sneeze, if they touch their nose or their face and they have nasal drainage. So again, the coronavirus, the symptoms are just like a cold or similar to the flu. And so again, the treatment as far as you know, trying to prevent the spread of the coronavirus is going to be the same as it would be for influenza.
And we're also seeing that the SARS, the numbers for the coronavirus deaths have already exceeded SARS back when it was an outbreak in China. But it's also similar. Coronavirus is SARS and SARS is coronavirus. Can you explain like what these strands are? Right.
Well, the coronavirus that's currently causing problems in China and then getting spread around is, they call it a novel coronavirus, or NCOV-19. That's because it's never been reported before or isolated or at least reported to cause illness. And the SARS virus, or severe acute respiratory syndrome, as well as MERS, Middle East respiratory syndrome, are also in the coronavirus family. Coronavirus is a large family of different viruses that affect mostly the respiratory tract. So again, SARS and MERS are also both coronavirus. Again, the symptoms the problem with some of the coronavirus is it can cause severe respiratory illness in a small amount of people. Again, the people that are affected most severely are going to be the very young and the very old.
And we're seeing a widespread of the flu as well. And, you know, hopefully people aren't freaking out too much about the coronavirus. As you were mentioning, it's not something to worry about currently right now, but it could potentially, you know, be out there. So what are some ways to prevent and try to keep yourself healthy?
Yeah. Well, first of all, recognize if you're sick, if you're not feeling well and you think you have some type of viral infection, sometimes a mask can be effective because the way it spread is via the respiratory droplets, like I said, mostly from coughing or sneezing. Hand washing is super important. Whether it's with warm water for 30 seconds in a sink and good disinfectant soap, or hand sanitizer is what you and I were talking about just a while ago. Hand sanitizer is very effective, it's very quick, and it's easy to have hand sanitizer on your desk, in the hallway, and all kind of places. So again, prevention is very similar to preventing the flu as far as the coronavirus is concerned.
Is there anything that I haven't had a chance to ask you, anything that people should know at home?
Again, you know, a lot of this is based on fear. You know, fear of the unknown. This is a new virus. I think I want to be reassuring from the standpoint of there's no specific treatment for coronavirus. If you're sick, you should probably stay indoors and check with your medical professional to see what may or may not be going on. I mean, we have to think about people that may think they have the flu and they could have pneumonia, which is treated differently than the flu. Just, you know, be smart. Good hand washing, good hygiene is the way to really prevent spread. The coronavirus is a virus and there's no specific treatment for it. But again, it can affect some people very severely.
Well, thank you so much for being here. Where can people contact you?
Well, we have 3 offices. We now have an office in Odessa on East 37th Street, and we have 2 locations in Midland, and our website is www.westtexurgentcare.com.
Thank you so much, Dr. Beck, for being here, and stay with us. After the break, we'll have a final 7-day recap, as well as looking at what's happening around the basin. Stay tuned.